Hi, my name is Letitia Roden. In this module, we'll be discussing Diabetes Self-Management Education Program, the secondary level of prevention led by DNP. In my table of contents, you will notice that we'll be discussing the prevalence of type 2 diabetes in Alabama, contributing factors, levels of prevention, secondary prevention, DNP-led initiative, Diabetes Self-Management Education Program, leadership competencies, and measures of success, and a conclusion. Type 2 diabetes burden in Alabama. According to the CDC, it is estimated that 15.2% of all adults in Alabama have diabetes. 127,000 are estimated to have diabetes but do not know it, which significantly increases their health risk. 37% of the adult population are pre-diabetic with blood glucose levels higher than normal but not high enough to be diagnosed as diabetes. Every year, a projected 31,000 people in Alabama are diagnosed with diabetes. People with diabetes have medical expenses approximately 2.3 times higher than those who do not have diabetes. Total direct medical expenses for diagnosis of and underdiagnosis diabetes, prediabetes, and gestational diabetes in Alabama was estimated at $4 billion in 2012. In addition, another $1.4 billion was spent in indirect costs from lost productivity due to diabetes. Type 2 diabetes progresses when the body becomes resistant to insulin or when the pancreas is unable to produce enough insulin. Exactly why this happens is unknown. Genetics and environmental factors such as obesity and inactive lifestyle seem to be contributing factors. Other contributing factors include high blood pressure, increased alcohol intake, and patients with high-fat, high-carb diets, and of course race. The vulnerable population here in Alabama is patients who are obese, senior citizens, African Americans, Native Americans, Hispanic Americans, and Asian Americans, low-income citizens, and those who are considered homeless. According to the CDC, obesity rates in Alabama is 36.3%, which is a 13.7% increase since 2000. African American population in Alabama is 26.6%. Other minority groups is 6%. Senior citizens rate in Alabama is 21.5%, and homeless is about 6,080 people. The poverty rate in Alabama is 24.7%. So why diabetes education? Diabetes is the major health condition which can lead to severe health complications such as loss of limbs, dependence on dialysis, and even death. Due to lack of screening and health services available, diabetes tend to be underdetected until the development of serious concerns. Diabetes causes a heavy burden on senior citizens and African Americans in Alabama. Especially widespread rural areas are related to obesity and the lack of exercise. Type 2 diabetes affects 29.1 million people in the United States and is the seventh leading cause of death, increasing all-cause mortality rate by 1.8 times compared to those without diabetes, increases the chance of having a heart attack by 1.8 times, and is the leading cause of kidney failure, lower limb amputation, and adult onset of blindness. Warning signs and symptoms of type 2 diabetes include frequent urination, increased thirst, always feeling hungry, slow healing cuts and wounds, blurry vision, feeling very tired, tingling, numbness, and pain in the hand or feet, patches of dark skin, and itching and yeast infection. Ways to relieve the burdens of type 2 diabetes include blood monitoring for sugar levels, taking medications as directed, following a sensible diet, regular exercise, and regular doctor visits. Other solutions to preventing diabetes: increase access to health care facilities, community education, and risk and prevention of diabetes, dietary changes, exercise and weight reduction programs, and frequent monitoring for complications. There are 3 levels of prevention. The first, which is primary prevention, focus on preventing the disease prior to a person getting the disease. The secondary prevention, it is early detection and rapid treatment of the disease at the earliest possible stage. The goal of secondary prevention is to either identify and cure the disease at a very early stage or slow the progression to prevent complications and limit disability. Tertiary prevention strategies are implemented during the middle and late stage of the clinical disease and referred to as measures taken to alleviate disability and restore effective functioning. The secondary prevention is the prevention that I chose for this specific module. The goal of secondary prevention is to either identify and cure the disease at a very early stage or slow the progression to prevent complications and limit disability. Secondary prevention measures are carried out during the preclinical or pre-symptomatic stage of the disease. Screening programs are designed to detect specific disease in its early stage while they are curable and to prevent and reduce morbidity and mortality related to the late diagnosis of the disease. Examples of secondary prevention include A1C testing, eye exams, and podiatrist exams. Oral glucose tolerance tests or measurements of fasting glucose or A1C, yearly health screenings, yearly eye exam, podiatrist exam, and nutrition and health coaching are some of the things that can aid in preventing secondary complications from the disease. So how can DNPs help? DNPs can be effective and help patients lower their A1C levels and improve clinical outcomes for patients with type 2 diabetes in collaboration with primary care physicians and in the primary care practice. By working in community health clinics, health departments, primary care facilities, and urgent health care units, DNPs can prevent type 2 diabetes and complications by providing regular checkups, blood testing, health counseling, and collaboration with primary care physicians, dietitians, podiatrists, and other healthcare team members to form personalized treatment plans. Teaching patients to monitor blood sugar levels, teaching proper skin care, providing education on signs and symptoms of hyper and hypoglycemia, providing monitoring equipment, providing referrals to eye care, wound care, and therapies, community education, and patient advocates are some of the ways that DNPs can help and prevent diabetes. So in the DNP initiative program, Diabetes Self-Management Education, the program was conducted by DNP by holding a small 90-minute educational session on self-management of type 2 diabetes. He started out with 5 clients. The American Association of Diabetes Educators 7 self-care behavior guidelines were used to develop the diabetes self-management program. The purpose was to evaluate the impact on diabetes self-management education of type 2 diabetes mellitus patients to lower the A1C. The goal was to improve the hemoglobin A1C and improve the patient's outcome. The community education provided by the DNP in small sessions around self-management and type 2 diabetes were how to monitor the signs and symptoms and disease prevention. These were some of the things that were taught in the classes. Collaboration with a dietitian around meal planning, eating habits, and healthy dieting was combined in the educational sessions. Health coaches to encourage daily exercise and healthy weight loss were used as part of the patient's education. Regular monitoring for complications by primary care providers and nurse practitioners, eye specialists, and podiatrists and nurse practitioners was encouraged by the DNP during each session. The leadership competencies that was very important in this particular project was collaborative leadership, which is the management practice that purpose to bring in different disciplines and staff out of their departments to work together. In collaborative workplaces, information is shared organically and everyone takes accountability for the entire project. In collaborative leadership was made between the dietitian, primary care provider, health coaches, pharmacies, and DNP conducting the project. Collaboration is very important in gathering the effective team to reach the desired outcome. You must have effective communication and good leadership skills and must be able to work well with others. Outcome evaluation was another important leadership competency in this particular project. Outcome evaluation is a process of determining how well the program accomplishes objectives. DNPs must have a clearly defined objective. The objective was to lower the overall blood glucose hemoglobin A1C levels. There must be a way to measure how well the objective has been achieved by frequent monitoring of the patient's health and blood glucose level. This served as a purpose of monitoring the overall outcome. Outcome evaluations continue. The third aspect of the outcome-based evaluation is analyzing the measured results, closely tracking how the patients understood information provided and monitoring necessary changes, tracking blood glucose levels and comparing results. With successful results, the program proved to be successful. If the results had not been successful, the program could either be modified or start a new project. The measurement of success. Did the project accomplish its goal? The average A1C for patients at the initiation of the diabetes self-management program was 9%. After the completion of the program, the mean reduction of A1C was 1.44% and the range change was 1% to 1.8%. 20% of the total participants met the objective of decreased A1C level below 7%. 5 patients, which was 100%, had a 10% decrease in the A1C levels after completing the program. So the score of the measurement of success was highly satisfied. Conclusion: mixing nurse practitioners and primary care teams to provide advanced methods of support to adults with uncontrolled hyperglycemia improves clinical outcomes and self-efficacy for patients with type 2 diabetes. DNPs are prepared to deliver patient-centered, population-based care as part of the interdisciplinary team, manage learning environments with diverse healthcare providers, and translate and implement findings from nursing education research. DNPs can fill openings in care and take on leadership roles in rural areas. As advanced practice nurses, we can work together with a physician through communication via phone or internet, provide community education opportunities. DNPs have served as professionals for changes in incorporating best practice in a care setting and providing cost-saving answers to patient care encounters while maintaining and improving outcomes. DNP's knowledge in clinical practice, health policies, and healthcare finance make them valuable providers to joint care teams and beneficial leaders of a healthcare organization. The end. Thank you very much.